everyone. My name is Joan Barrett, and I'm the Executive Director of the Lakes Area Community Coalition. And thanks for joining us for this session of our Ask the Expert videos. Today we are talking with Rich Isaacson. Rich is a special agent retired with the Drug Enforcement Administration, which is a community outreach specialist. And he's going to talk to us today a little bit about his role with the DEA and how it affects us here in the Lakes area. Good morning, Rich.
Good morning. Thanks for having me.
Thank you for joining us. Tell me a little bit about the Drug Enforcement Administration and how it helps us here in the Lakes area.
Sure. The DEA is part of the Department of Justice. We are a single mission agency. All that we do in the DEA is enforce the federal drug laws. So in a nutshell, we're enforcing Title 21 of the Federal Criminal Code, which means we're going after the largest drug trafficking organizations that are operating here in the United States. That being said, we recognize that we have such a large substance use problem in this country and a lot of substance use disorder, and we feel the most effective way to reduce substance use in this country is to try to attack it from a holistic approach. We, of course, enforcement, trying to rid the supply of the illegal drugs is a very important part of the equation, but we recognize how important it is to work with professionals in drug prevention and education, and also treatment and recovery, and try to attack substance use from all angles. And so that's where I retired. I was a special agent for over 26 years, and I became passionate about drug prevention and drug education in the latter half of my career, as I had children myself, and I was trying to do whatever I could to try to educate my two sons and their friends about the dangers of illegal drugs. So I became passionate about prevention, and I got into that a little bit in the latter half of my DEA agent career. And so when the opportunity came up to do community outreach work as a contractor for the DEA, it was really a good fit when I retired from the law enforcement role. And you know, the DEA is really, we're three-pronged. We have the side of DEA that goes after the illegal trafficking groups. The majority of the illegal drugs are controlled by the Mexican drug cartels. So our special agents are going after those poly-drug trafficking groups, multiple drug trafficking groups that are selling cocaine and methamphetamine and heroin and marijuana. So that's the main side of DEA's house. And then we have a diversion control section. They're the folks, the investigators that regulate the medical professionals that handle our controlled substance prescription drugs, make sure that they're handling things properly and following the rules and regulations so that we have a safe prescription drug supply, which is all the more important right now during this pandemic. And then we have the community outreach section where we're trying to raise awareness to the dangers of illegal drugs. So really it's a three-pronged approach that we have here in the DEA, and we're just doing as much as we can in the community outreach section to raise awareness about the dangers of different substances.
Thank you so much for your work with us and in the community, in the prevention world. Of course, that's our passion, and we're really grateful for your commitment to the prevention side of this. Sure. Tell me, Rich, what are some trends that the DEA is seeing regarding drug use during COVID-19?
We are certainly concerned, talking to people in the drug treatment and recovery community over the last couple of weeks, that there certainly is an increase in use. Talking to folks in the community, we know there's an increase in use among the user population, but we're concerned that they're not utilizing the treatment and recovery resources. And so those folks that are working in recovery are really concerned that there are people out there that are not utilizing some of the resources that are available. And so that's a real timely issue right now. There's a lot of mental health issues associated with people being locked up in their homes. And sometimes that might be an issue that's overlooked during this pandemic, and it's a very important concern to make sure those folks that might be suffering from different substance issues, or maybe they don't have access to the normal support groups. We need to make sure that we let them know that there are resources available for them, and they need to continue to reach out to those folks that they are under the perception that those folks are not doing their jobs currently and they're not available to them, but those resources are available. And we also know, on the enforcement side of the house, which I'm still tied to fairly closely, the DEA is as busy as ever. We know the supply side of the drugs are continuing to flow. Crime doesn't rest in a pandemic, right? And so our DEA enforcement side of the house is as busy as ever with seizures of heroin, cocaine, and methamphetamine. and fentanyl, of course, is related to all of those. And so, it's in a sense, it's somewhat sad to say, but the drug trafficking continues as vibrantly as it ever has.
Yeah. Rich, tell me, how are Lakes area young people impacted by the adult use of both legal drugs like alcohol, marijuana, and illegal drugs?
Well, it's such a important question, because parental input, adult input really does play a large role in our youth use. I think sometimes parents may overlook the fact that they have as much influence as they do on their teenager, or they think, hey, if marijuana use is as popular as they perceive it to be, what they say may or may not influence their children's use. And the research is pretty clear on this. You can go into Health and Human Services and Monitoring the Future surveys. Parental input does play a large role. And so, especially right now, during this pandemic, if you're on social media at all, oftentimes you see adults joking about using wine or other substances to cope with being stuck at home. And I really caution parents to be aware of how that may influence their young people. Their kids may perceive that, hey, alcohol is a crutch. It's more acceptable. It may lower their perception of risk for alcohol or other drugs. And we do know it's very clear, especially when you refer to the Monitoring the Future survey, which is done right at the University of Michigan, that when perception of risk for substances go down, the user rates go up. And so we're concerned, especially in our current environment, as marijuana has become our third legal drug in the state of Michigan, perception of risk has come down with that. And we are concerned that user rates may very likely go up. We have seen that in some of the other states that legalized marijuana previously. And so that and alcohol, those are the most prevalent substances in our community. We used to call them gateway drugs, call them pathway drugs. Yeah. They're the drugs that are most available. And when you have a lower perception of risk for those pathway drugs, yeah, the user rates are likely to increase. And so it's very important for parents to be aware of their behavior in front of their kids and how their children perceive their attitudes towards alcohol and the other drugs.
How would you recommend that people in the Lakes area prevent the misuse of prescription drugs at this time?
Well, it's a good question. We've actually had success. We're not really talking about the history of the opioid epidemic this morning, but the heart of the opioid epidemic over the last decade started with the misuse of prescription painkillers. And we've actually done a pretty good job with our young people over the last 7 years or so. Our misuse of prescription painkillers has gone down pretty dramatically among our high school age teenagers in the United States. So we've had success. I think the important thing is to make sure we raise awareness to the dangers of prescription drugs. I think some people in the past, and some obviously still do, have the perception if you misuse prescription drugs, it's somehow safer than using illegal drugs. Totally flawed logic. All you have to do is look at the tens of thousands of people that have died of prescription drug overdoses to know that's flawed logic. So we need to make sure that our young people are aware of how dangerous it is to misuse the non-medical use, the off-label use of prescription drugs. And not just painkillers. I think we really need to start raising awareness about stimulant abuse, the misuse of Adderall and Ritalin, and also the depressant drugs like benzodiazepines, Xanax and Valium. I think the majority of our population probably doesn't realize how prevalent the misuse of those classes of prescription drugs are as well. And I just think we think the next wave of this opioid epidemic is stimulant abuse tied with fentanyl. We're finding fentanyl mixed with our cocaine and our methamphetamine across the country and in Michigan for sure. And a lot of that stimulant abuse starts with our young people misusing the prescription stimulants like Adderall first. And then that leads, it's almost like a pathway towards using stimulants like cocaine and methamphetamine. So we need to continue to raise awareness about the dangers of all controlled substance prescription drugs, because we're really concerned. Heck, we lost, in this country the last couple of years, we've lost over 10,000 people a year that had benzodiazepines in their bloodstream. 10,000 people overdosing on a prescription drug like Xanax. I think surprises people. We hear a lot about heroin and fentanyl for good reason. I mean, we lose over 15,000 people a year to heroin, but heck, we're losing almost 10,000 people a year with benzodiazepine-related overdoses. So we need to continue to raise awareness about the dangers of these substances to continue some of the positive trends with prescription drug abuse among our young people. It is doable, as we've seen over the last 6 years, as we've reduced painkiller abuse among our teenagers, and we can do that with all prescription drugs.
Rich, I want to thank you so much for taking time with us today. I appreciate your work in this field. I appreciate your partnership with the Lakes Area Community Coalition.
Well, thank you. Thank you for including the DEA. It's something a lot of people don't realize, that the DEA, this enforcement arm, does try to do as much community outreach as possible. So we really appreciate your efforts and all the coalitions in Southeast Michigan. So thanks to the Lakes Area Community Coalition for having us.
You're welcome. Thank you so much. And thank you for partnering with us today to help build a healthy, vibrant, drug-free Lakes area community.
Thank you.